you, everyone. Thanks for inviting me to speak at this event. When Dr. Lambert called me and asked me to speak, I thought, okay, let's, and I got this schedule. I was grateful to be invited and grateful to be asked, and I was very grateful not to have to speak immediately after lunch. Anybody who has to speak at any time point about sleep, the worst place to be is after lunch. But then I'm now the only thing standing between you and the end of the day. That's also a very bad time to be asked to talk about sleep. And I'm very grateful, when I was thinking about what am I going to talk about, he kind of gave you the guys that general title of sleep medicine, but I'm very grateful to the people who put their thoughts about what they wanted to know about sleep medicine, because I could have gone in any 800 different directions for this. So I'm grateful to the people who put their thoughts back through the portal about the types of things that you would want, so I could tailor what I'm talking about a little bit more. So when I started going, I was like, okay, let me go out there and see what's the research, what do we know about sleep and sleep disorders and autoimmune hepatitis. So guess what? It's a very short talk. It's just a big empty box. We can all go home, go get your snacks, head to the bar, we're done for the day. So I had to reel it back in and start all over again and start this talk. So I started with thinking, okay, what does good sleep look like? We know what good sleep feels like. When we wake up, we want to put good sleep in a bottle and say, I want that every night for the rest of my life. I want to feel that way. But what does good sleep look like? So this is what we call in the sleep world, we call it a hypnogram. If you could sleep like this every night for the rest of your life, this is what it would look like. There's different stages of sleep. REM, or rapid eye movement sleep, is what we call dream sleep. But I'll let you in on a little secret. We can actually dream in any stage of sleep. Really, REM is where we process our emotions, and if you actually look at what's going on during REM sleep, it actually looks a lot like wakefulness. Your eyes are moving, your brain is very active, but your skeletal muscles are paralyzed, so you can't move because your brain is moving like you're awake. Stage 1 sleep is very light sleep, and people who get a lot of stage 1 sleep in their hypnogram, if we look at somebody who has a hypnogram that has a lot of stage 1 sleep, they will tell you, Doc, I didn't sleep at all. And that's true, because people who have a lot of stage 1 sleep will actually feel like they're awake because it's so light. People who get a lot of stage 1 sleep on their hypnogram feel like they've been awake for a lot of the night because it's such light sleep. Stage 2 sleep is what I consider typical sleep. You spend about half of your night in stage 2 sleep, and then the deepest sleep is slow wave sleep. And if you look at this hypnogram here, you see you kind of go in to sleep. Most people take about 10 to 15 minutes to fall asleep, usually no more than 30. Get very little stage 1 sleep, quickly go into 2, and then get the slow wave sleep here in the first third of the night. Hit their first REM cycle, which is usually pretty short in the first hour and a half, and then over the course of the night, their REM cycles get longer and longer, and get somewhere between 7 to 8 hours of sleep. And that's what a good night's sleep look like. Most people are asleep anywhere from about 85 to 90% of the time they're in bed. You may have a few short awakenings over the course of the night. That's pretty normal. It's not so bad, and you feel pretty good when you wake up. What does bad sleep look like? That's what bad sleep looks like, but everybody's bad sleep is different. It can have a lot of arousals from sleep. You're coming up into awakening a lot. You can have decreased or no slow wave sleep, so that deep restorative sleep is not there. You can have a lot of bouncing between stages. Between stages. So even when you are asleep, you're not sustaining any one stage. You're coming up into the lighter stages very frequently, and the amount of time you're asleep is decreased. Somebody else's bad sleep, maybe they went to bed, they didn't fall asleep, they were awake for an hour before they went to sleep. And then they stayed asleep for maybe an hour, but then they woke up and were awake again for another hour. So that may be somebody else's bad sleep. So good sleep kind of all looks the same, but somebody else's bad sleep may look very different from somebody else's bad sleep. But we all know what bad sleep feels like, and everybody's had a bad night's sleep in their lifetime. And some people have almost bad night's sleep almost every night. So why do you get bad night's sleep? There's lots of different factors that factor into a bad night's sleep. Some of it can be our bad habits that give us bad night's sleep. And we all have bad habits that factor into our bad sleep. And sometimes our bad habits lead to insomnia and perpetuating bad sleep over time. Our sleep environment and things in our environment can perpetuate bad sleep too. But then there's a whole host of medical factors and our medications and things that contribute as well. So we have to think about our mental health, our health conditions. Is there a true sleep disorder underlying bad sleep? And pain. So all these things can go together to create bad sleep, and we have to think about bad sleep in the big picture, about all the things that are contributing and playing into bad sleep. But you just spent the last session, many of you, in the breakout, talking about immune disorders. So I want to start by talking a little bit about immune disorders, but let's think a little bit first about other medical disorders. So I just included a few medical disorders, but almost any medical disorder can lead to bad sleep. But some of the common ones, heart failure frequently can lead to bad sleep. Neurological disorders, including stroke, lung disorders. One of the things we ask asthmatics all the time is how much is your breathing waking you up at night? That's a sign of a poorly controlled asthmatic. Renal failure, frequently. Patients who have kidney disease wake up kicking their legs frequently at night. Thyroid disease. Arthritis wakes people up in pain. Heartburn wakes people up, especially if you're not careful about what you eat at night. And autoimmune disorders. So let's think about the immune system and sleep. And this graphic, and I'll tell you, really, what we know about immune disorders and sleep is kind of in its infancy. So we're just scratching the surface of immune disorders and sleep, really. But if you look at this picture, you can see sleep here in the middle and a whole bunch of arrows going both ways. We know that you need sleep for good immune system functioning. You need sleep for good neuroendocrine, autonomic system, and circadian rhythm functioning. So really, when you go to sleep, you're allowing your body system. When I think about why we sleep, people will say, well, why do we need sleep? Well, we know we need sleep for many reasons. It's highly preserved across all organisms. In fish, if you think about fish even sleep, and you probably have heard this before, they sleep half of their brain at a time, right? So one half goes to sleep, one eye's open so that they don't get eaten by the predator that's swimming around. Then their other half goes to sleep, the other eye's open. So every organism sleeps. And the reason, when you think about why we're sleeping to, I think of it in different ways. Our brain, our neurons are resting. In some ways, it's for our brain to take out the trash. It's a lot of way our brain is getting rid of the byproducts of all the thinking we're doing during the day. It's allowing our brain to go through some of the neuroendocrine processes that it needs to. That's the time when our growth hormone peaks. It allows the shifts in cortisol. A lot of our endocrine processes work on a 24-hour cycle, so you need that rest to allow the cortisol and thyroid hormones and everything to balance out. You need to allow your parasympathetic and sympathetic balance, so you need the sympathetic system to go down, blood pressure to go down, everything kind of rests, it goes down a little bit at night, and the parasympathetic system takes over. So you need that rest. The circadian rhythm, that's when the circadian balance goes down. Everybody works on a circadian balance. So we need all of that to happen. But a lot of parts of the immune system are active during sleep. And if you deprive people of sleep, and we do these experiments, they seem cruel, but we do these experiments where we force sleep deprived people. And you can do it acutely, where we make people stay awake for 24 or 48 hours, or sometimes even longer. And when we start making people acutely stay awake for long periods of time, we see their white blood cells go up, and we see these things called cytokines, which are proteins in the blood that stimulate inflammation. We see those start to rise. So if you're not getting good sleep, either acutely or chronically, and we do those chronic sleep deprivation experiments, which means we sleep restrict and say you can't sleep more than 4 hours, and then we wake you up and we watch you, we won't let you nap, we start to see the same things happen. So if you have a chronic problem with your sleep, your immune system goes really out of whack. And when we look at the immune system and mediators such as tumor necrosis factor alpha or interleukin 1 beta, if you give those things to animals, it makes people sleepy. So we know that these are cytokines that make people feel sleepy and fatigued, and that may be contributing somewhat to some of these disease processes where people feel tired and run down all the time. When you have immune disorders, that may be partly contributing to some of the fatigue and sleepiness that you feel. Interestingly, large group, this was out of Taiwan. So when they followed people for 10 years, and they had a cohort of people who had sleep apnea, which is one of the most common sleep disorders. And then they had a group that didn't have sleep apnea, and they followed them for 10 years. And they looked to see, did these people develop an autoimmune disorder of any type, whether it was rheumatoid arthritis or lupus or Sjogren's syndrome. And the people who had sleep disorders had a higher likelihood of developing an autoimmune disorder over 10 years. And it was very small incidence, 0.1, and this was the non-sleep apnea, and 0.03. But it was twice as likely that these people would go on to develop an autoimmune disorder. So bad sleep, no matter why you get bad sleep, increased the likelihood that you would go on to develop an autoimmune disorder. So somehow sleep, if you're not getting good quality sleep, it's messing with your immune system. That's the bottom line here, and can contribute to the development of an autoimmune disorder in the future. Other things that sleep is linked to, and this I know probably is kind of hard to read, but this is a conceptual. So this is the conceptual. You have fatigue in one circle, pain in one circle, and like depression, anxiety, mental health. And all of these contribute to the overall disease activity in immune disorders. And this was particularly thinking about rheumatoid arthritis and other autoimmune disorders. And if you kind of think about it another way, if you take disease activity out and think of that as inflammatory cytokines, this is where that TNF-alpha, IL-1 beta, this is all kind of comes back together in that middle part. So you got, and that can come back together with the sleepiness and fatigue. So it's all kind of pulling back in with this inflammation, sort of coming together between your fatigue and your pain and sleepiness, kind of all comes back together in the middle of that picture. The other thing we know, again, if you start sleep depriving people, you find out a lot of things. This is another one of those experimental conditions where they took people and they took a group of people and they said, for some of them, we're just going to let you, the people in blue got to sleep 8 hours. The people in red, they said, for 5 days, we're going to let you sleep 4 hours, and then the gray days, you're going to get to sleep 2 hours. And they did that for 3 weeks. For 3 weeks, they did that. And at the end of 3 weeks, they looked at their self-report of headache, generalized body ache, back pain, and stomach pain. And sure enough, the people who were sleep deprived started reporting more and more pain. It decreased their pain, or it increased their pain sensitivity. So if you don't feel good, you experience more pain. If you don't sleep well, it changes your pain sensitivity. And the other thing they do in these sleep deprivation experiences, the other thing they do is they actually test. They see how sensitive you are to pain. So they'll get a thing of cold water, ice water, and they'll put your hand in it and see how long you can keep your hand in the ice water. And the people who've been sleep deprived can't keep their hand in the ice water as long as the people who are well rested. And then they get some hot water, see how long you can keep your hand in the hot water. So the people who are sleep deprived they have just really poor tolerance for both heat and cold. And they also pinprick you. See how tolerant you are to pinpricks. And if you're not well rested, you have zero tolerance for sort of these standard pain experiments. So if you're not getting good rest, you have poor pain tolerance. So this is all interrelated. Sleep does not do good for your pain. If you're not getting good rest, your pain tolerance is poor as well. Don't sign up for sleep experiments. That's the bottom line here. Poor sleep is also linked to your mental health. It's really interesting when you think about depression. So if you have insomnia, people who report chronic insomnia are 10 times more likely to go on to develop depression. And if you have impaired sleep and you have a diagnosis of depression, that in and of itself is a risk factor for suicide. And we look at the sleep study, the people who have depression have less slow wave sleep, and they have more intense REM sleep where their eye movements, when we look at the eye movements in REM sleep, they're going crazy. And what's really interesting is if you go to a first-degree relative, like a brother or sister or parent, their eye movements are even more intense. They may not be depressed, so that kind of goes back to that idea that depression has a genetic basis. And even if the parent's not depressed, there's something about their REM sleep that's different. So maybe the sleep, this disordered sleep we see is somehow related to the development of depression. So it's something that was there before, not necessarily the cause of the depression, or can be causally linked to the depression in some way, because even the relatives have abnormal REM sleep, interestingly enough. Of course, anxiety, anybody who's been anxious knows it's really hard to go to sleep. Your thoughts are racing, you can't shut your mind off. People who have a lot of anxiety are generally what we call hyper-aroused. You know, you're like this all the time. And those people tend to sleep kind of in a light plane anyway. Because people who have anxiety, it's really strongly linked with insomnia. So if you look at their sleep, it often has a lot of arousals. Any little bump in the night, they're, what's going on? And you see sort of more in that stage 1 and 2 than you would otherwise expect. So this, again, it's talking about medications. Too small for you guys to read, but I like to point out a few things. Medicines, I think if you're having bad sleep, you need to sit down and talk to your doctor and say, hey, can you cut back my med list? There's probably something on here that's affecting my sleep. And a few medicines I always like to point out, I think diuretics, right, is going to affect your sleep. Lasix, I always say, means last 6. So if you're going to take a Lasix dose, it's going to last 6 hours, so take your Lasix at least 6 hours before you go to bed. There's sneaky meds that contain alcohol. So your cough syrups are going to contain alcohol, so that can disrupt your sleep. There's some sneaky meds that contain caffeine that can disrupt your sleep. So like Excedrin migraine has caffeine in it. So if you're taking, or Midol, things like that are going to disrupt your sleep. So think about that. Some antidepressants, the SSRIs like Prozac, Paxil, those medicines can disrupt your sleep as well. So you really need to look very carefully at your medication list and sit down with your doctor or your pharmacist and talk about which medicines might be disrupting your sleep. So what are the non-medical reasons that people get bad sleep? I think one thing is really irregular sleep and napping. If you guys have kids, which I'm sure many of you do, you wouldn't let your kid go to bed one night at 8 p.m. and one night at midnight. So you should think of yourself the same way. People need regular sleep schedules. And if you don't keep a regular sleep schedule, your brain likes having a regular sleep schedule. And your brain likes routine. You should be disciplined about your own sleep as you would be about your kids' sleep. And if you're not, then your brain goes like, I don't know what I'm supposed to be doing. So the brain likes it. The people who feel most well rested are people who get regular sleep schedules. Think about your caffeine intake. Late night snacking will throw you off. Don't take nightcaps. Alcohol before bed will throw you off. Exercising too close to bed is arousing. So if you're going to exercise, you need to exercise 3 or 4 hours before bed. And we're going to talk a little bit about electronics. And then you have to think about your environment. TV and electronics in the bedroom. Make sure your bedroom's not too hot, too loud, too bright, too uncomfortable, right? Your bedroom has got to be a sanctuary. So invest in that good mattress and those wonderful pillows. And think about your pets and your kids in the bedroom and whether that's something that you want to have. All right, back to the disciplined sleepers. A disciplined sleeper should not deviate really more than an hour from when they go to bed and when they wake up. And that's a hard one. That's a hard one to do. But the people who do that are 1.5 times more likely to report feeling well rested. So that's really tough, especially people who suffer from chronic illness. There's going to be days you feel really tired. There will be days when you feel like, I can't get up and get out of bed, or I need a nap today. But those naps, if you take really long naps, those naps are going to take away from your sleep at night. So if you're getting an hour or 2 hours during the day, that's going to be an hour. That's going to take away from your nocturnal sleep. So you have to be pretty disciplined about how you sleep. And if you're going to be disciplined about how you sleep, I always say the first place to anchor is when you wake up. It's not when you go to bed, it's when you wake up. And it's like, okay, if I'm say 7 a.m. is my time I'm going to get up, even if you stay up late, you still have to get up at 7 a.m., even if you don't want to. And that's hard for me. That's the hardest one for me because my natural rhythm is I'm a 12 to 8. Like if I could run the world, I would go to bed at midnight and get up at 8. That's just who I am. But that doesn't work when I need to be at work before 8 most days at the hospital. So I have to make myself, even on the weekends, get up by 7 because on the weekdays I'm up at 6. So I still have to enforce that rhythm or I get tired. And that's just the way life is. Caffeine is good in moderation. I think we all know we love caffeine. Caffeine has many beneficial effects. There's been many studies that show a few cups of coffee will actually decrease your risk of a few cancers. But I think just a few points I like to make about caffeine is your sensitivity is going to change with age. You tend to get more sensitive to the effects of caffeine as you get older. So you can't drink as many cups when you get older as you could when you were younger. And I usually tell people, try not to, especially if you're having a hard time falling asleep and staying asleep, try to avoid it after between noon and 2 because it's going to last around 7 hours. And I include this to show you the wide variety of caffeine content in things. A large Starbucks has 400 milligrams of caffeine. It's a lot of caffeine. But your coffee that you're going to make in your Keurig has about 95 milligrams of caffeine. So just to kind of, an espresso, you always think, oh, espresso, that's got a lot of caffeine. No, it's got 75 milligrams. So, it's not that much. So you just kind of have to think about how much caffeine is in things. So if you want a lot of caffeine, go get the big Starbucks. If you don't want a lot of caffeine, just get, and oftentimes you think, oh, these energy drinks have a lot of caffeine. Actually, they don't really. So it's just kind of thinking about what you're getting for your money. And thinking about alcohol and sleep. So in the background is what's sort of a normal sleep-wake cycle. It has slow-wave sleep into stages 3 and 4, but this is slow-wave sleep. So what alcohol does to sleep, it may put you to sleep, but it doesn't keep you to sleep. It puts you rapidly into deep sleep, but it keeps you from going into REM sleep. And most people will then develop what's called REM rebound. So in the later stage of sleep, you get this really long REM cycles at the end of the night and rebound. And oftentimes people will have these broken dreams and almost frightful dreams toward the end of the night. So people who drink alcohol close to bed will often report toward the end of the night sort of this rebounding into sort of long, frightful dreams. So that's why having alcohol right before bed is a bad idea. All right. So technology and sleep. The National Sleep Foundation does these polls every year where they go out and they ask anywhere between 1,000 and 2,000 Americans about some topic of interest. This was done in 2011, so here we are, 8 years later, and I'm sure it's probably even worse. So at this time, 60% of people had a television in the bedroom and they watched it in the hour before bed. And they divided the poll into Gen Zers, which was teenagers, Gen Y, which was between 19 and 30, Gen X, which was up to the age of 45, and baby boomers, which was 46 and older. And you can see the teenagers to age 30, up to 70% were on the internet and using social network in the hour before bed. The older individuals weren't doing as much on the internet, but some of them were. And then a lot of people were watching videos, using word processing, listening to music. So people in the hour before bed, lots of people were on the internet. And I think it's true for many people. Many people are on the internet right before bed. And I think it's only getting worse over time, right? So why is this such a bad thing? Got the light, it's a blue light. Here's your eyeball. We isolated the eyeball. Blue light's going right there. That blue light goes in, stimulates the suprachiasmatic nucleus. Why do we care? Well, that goes to the pineal gland. So the suprachiasmatic nucleus and the pineal gland are part of your circadian rhythm. And when you stimulate that at night, you're pushing back and delaying your circadian rhythm. That's what we call your phase delay. And that makes it harder for you to fall asleep. Just kind of looking at that within the hour before bedtime, your eyes like, it's still light outside. My melatonin is not ready to go down, and it's not time for me to go to bed yet. So this right here is delaying your phase, your circadian phase, and pushing back the time your body says it's time to go to sleep. So that's why you hear about these blue blocker lenses and trying to delay blue light. And it also changes your cortisol, and your cortisol is supposed to go down at night, and it's elevating your cortisol. So those two things is why blue light at night is bad, and it makes it harder for people to go to sleep. So if you have your teenagers who are doing this at nighttime and they don't want to go to bed, this is part of it too. So that's why your kids are having trouble too. So take their devices away too. Other essential elements of the environment, if you ask the same sort of Sleep in America and you ask them, hey, what's important in the environment? If you look at this, if you just ask people, this is another Sleep in America poll, and you're asking people, the things that are important to people are pillows, bedroom temperature, bedroom darkness, and sheets. So those are the most important things in the bedroom. If you ask people, what's the important thing for me in my environment? It's not children in your bed or pets in your bed, although maybe not that many people have that, but it's the other things about your environment that's really important. What about pets in the bed? They actually studied this. So when they looked at and they studied the humans, and they studied the dogs. And the humans were asleep 81% of the time that the dogs were in the bed. And the dogs were asleep, rest time was 85% and active time was 12. So the dogs didn't really disturb the humans that much. And I think this was in the news earlier this year that, you know what, it's okay. They're not really going to bother you. And I think it depends on the person. I was like, well, if you like your dog in your bed and you feel like you sleep well with your dog in your bed, you go for it. But if the dog disturbs you, then maybe you should get the dog out. That's what I tell people. It just depends on you. Some people feel like they rest well with the dog in the bed, so then that works for you. All right. I know I'm getting close to my time, so let's kind of end with a few final slides. So how can you be a good or at least a better sleeper? You have to find the right environment for you. I don't know what your temperature is. I don't know what kind of pillows you like. You have to figure it out for yourself. Everybody's got a personal environment that's going to work for them. You do have to find a schedule and stick with it. Your brain's not going to like you if you go to bed at different times every night. You're going to have to find that schedule. Yes, being acutely ill is going to throw you off. As soon as you can get back to a schedule, you need to get back to a schedule. You have to find your schedule, you have to stick with it, and it's hard, and I know it. You have to get the right treatment for your medical and mental health conditions, narrow your medication list, find the things that are going to be a problem for you. And then seek help if you have a sleep disorder, and we're going to talk about a few of the common sleep disorders and when you should seek help. Some of the questions I was asked is, what about some of these alternative therapies? What's the right environment? Cool, dark, and quiet. Room darkening shades, noise machines, lavender oils. Do these things work? When they test these, when you test these in like a sleep lab, people will wake up and say, yeah, I slept better. But if you look objectively, did the patient sleep any longer with or without those? They don't. But the patient feels like they did. So if you feel like you sleep better with a noise machine or lavender oil, then go for it, right? Because if you feel like you sleep better, then by God, you slept better, right? And I'll tell you, I've slept with a sound, my daughter's 10 years old, and I've slept with a sound machine since she was 10 years old. And I feel like I don't sleep as well without it, because I've trained myself to know that when that sound machine goes on, it's time for me to go to sleep, it's time for me to sort of settle in. And if I'm traveling and I don't have a sound machine, every bump, every noise starts to wake me up, because that's part of my sleep routine now, because I've created a routine. So I think you have to create your routine and figure out what's your environment. And the thing about pillows, my husband has had orthopedic injuries. He was a football player. He sleeps with 8 pillows. His shoulders are up like this. I think I've spent a mint on pillows. So you got to figure out what, like he's like a mummy in the bed at night. He's like this. So you have to find him. You just have to figure out what works for you. How many hours of sleep do you need? You'll hear some people say, I need 4 hours of sleep. I need 3 hours of sleep. There is like less than 0.5% of the population needs 4 hours of sleep a night. The same is true. There's actually a sleep disorder called idiopathic hypersomnia with long sleep time, where those are the people who need 10 or more hours of sleep. That's a sleep disorder. If you truly need 10 hours of sleep to feel rested and function, then you have a sleep disorder. So people who are on those far ends of the spectrum are sleep disorders. Most people need 7 to 9 hours of sleep. And people who force themselves or are really on those ends of the spectrum, those have been actually associated with an increased risk of having cancer, death, heart disease. So if you're a person who needs more sleep and you're like, set your alarm and you're getting up and you're only sleeping 4 hours of sleep, then you're actually harming your health. So you need to find how much sleep you get and make sure you get that amount of sleep. So when do you need to ask for help? Sleep apnea is the most common sleep disorder. That's when you obstruct the back of your throat. Your symptom, loud snoring. Your bed partner will tell you when you do it. They will punch you. They will tell you it's time for you to get help. So go to the doctor, get help. A different type of sleep apnea is central sleep apnea. That's often associated with heart failure. It can be associated with opioid pain medications. That's when your brain doesn't tell you to breathe. You stop breathing at night because your brain doesn't send you the signal to breathe. Insomnia. I think everybody experiences insomnia at some point in their life. It becomes a problem if it's persistent and pervasive, lasting longer than about 6 months and interfering with your daytime. So if you experience prolonged insomnia, go get help. Restless legs is that urge to move. You got to get up. You got to move your legs. You should get help for that if it's interfering with your sleep and you have more than a few nights per week that you can't fall asleep and stay asleep because you got to get up and walk. And true hypersomnia disorders are rare. Most of the time, hypersomnolence is caused by something else up here. But true hypersomnia, like narcolepsy, is pretty rare. So you should get evaluated if you're falling asleep behind the wheel of the car. That's dangerous. We don't want you on the road. I don't want to be on the road with you. Go get help if you're falling asleep. Times you're not supposed to. If you can't sleep, get up and get out of bed. Go do something. You shouldn't be in that bed longer than 20 or 30 minutes without sleeping. Because then you're going to hate the bed. Then you create cycles. That creates part of the negative cycle. Do low light activities. Read in low light, listen to soft music. But you shouldn't get on your computer or a tablet unless you have a blue blocker lens, unless you have a screen with a blue light, unless you're blocking that blue light. All medication fails. So if you're going to use melatonin or over-the-counter sleep aids or any sleep aids, it's going to fail if you start to use it every night. So that's why you need to go see somebody if your insomnia is persistent. There is something called cognitive behavior. This works. Cognitive behavioral therapy for insomnia works if you do it. It's hard. You can do it with a therapist. You can do it via app. It's been proven to be better than sleep aids at year 1 or year 2. This is one app that's free. They actually mentioned it on NPR. That's how I heard about it. When you do it, it includes like sleep restriction. People are like, oh, but I'm already tired. You can't restrict my sleep. But the idea is maximizing the amount of time at bed you're actually asleep. So maximizing that sleep efficiency. And then you can't nap the next day. So you're like, okay, when I'm in bed, I'm going to be asleep. When I'm out of bed, I'm going to be awake. And then trying to retrain your brain to sleep is, again, it's like sleep training your kid. You got to sleep train yourself too. So a few final thoughts. Sleep is very intricately linked with your immunity, your mental health, and your pain. It's hard. We really don't understand how everything is linked, but you have to begin to treat your sleep as important, and to do it is important. You have to first have the right environment and the right attitude and discipline for sleep. And if you think you need help, go get help. There's plenty of sleep doctors out there in the community. So thank you very much for your time and attention. I appreciate it. Yeah, and I'm sorry I overran time. All right, go ahead.
Is there a particular doctor that you said a sleep doctor? Because my primary nor my GI or hepatologist are using my RLS.
Yes.
And I need to get it.
Can you repeat the question?
Yes. So she asked if there's somebody to see for restless leg syndrome. So there are sleep specialists, and depending on where you live. So different doctors, so there are specific specialists for sleep. Neurologists often see patients for RLS, and there are doctors who are trained in sleep medicine within the IU system, and you can just look on the system for our sleep specialist as well.
You have another question?
Two-part question. Can you make up for sleep you don't get during the week on the weekends?
You shouldn't. You should try to keep because then you're often prolonging, right, a lot so you shouldn't stay in bed longer than an hour on the weekend. You can sleep in by about an hour, but you shouldn't sleep in by more than an hour on the weekend.
Okay, those are ideal situations.
Those are ideal situations.
And that's what you're aiming for. But suppose you're going for weeks on a time and you're only getting 2 hours a night or 3 hours a night. Do you then allow naps?
Why would you only be getting 2 to 3 hours per night?
Ask my wife.
Because then because if you're only getting 2 to 3 hours per night, then you probably have a problem that you should see a sleep specialist for. Because
She has. It's not working.
Yeah. Yeah, because I think we need to work on the bigger problem of why you're only getting 2 to 3 hours per night and try to improve that problem first. And because I think that's really the bigger problem, right, is why would you only be getting 2 to 3 hours per night most nights? Because that's not the ideal situation. Should you be sleeping in on the weekends? Maybe, but getting 2 to 3 hours per night is probably not the ideal every night, right? That's the problem that needs to be fixed.
Any other questions? Okay. Back there.
I was just a little bit confused and curious about the different kinds of light and the blue light and the screens and all that stuff. So like Windows 10, I think it is, there's a setting is that effective that, it dims to...
It's reasonably effective to do the blue light filter. I think the blue blocking glasses are better.
Glasses.
Yeah, you can buy them online, the little blue blocker glasses.
Okay, and do you have anything to say in the comparison between incandescent, LED, and fluorescent light regarding right before bed?
Right before bed. No, I think they're all they're fine as long as it's not like it's backlit, right? Like kind of keeping it backlit and sort of 60 to lower wattage. Yeah, it's okay.
Is melatonin like more than I don't really need this. I can project. Is melatonin like say once a week okay? Or?
Yeah, that's fine. And sort of in the 3 to 5 milligram range is usually the dose. That's usually the sort of over the most of the things that you buy are going to be in that range dose.
Great. Thank you so much, Dr. Brown.
You're welcome.
Appreciate it.